People joining, so give it a bit more time before we kick off.
Shall I kill time and talk about the weather? It's very
No, it's raining here.
yes, magnificent. It's like the weather in the west of Ireland. I mean, 4 seasons in one day. It's amazing.
Absolutely.
They talk about a soft day in the west.
Yes. Yeah. Yeah.
Just a day.
Well, yeah. Well,
Been to Ireland.
Days pretty elongated, you know.
Yeah, it's a very beautiful country, but it's like Wales. There's a reason it's so green.
Well, yes. And lots of rain is why, obviously, Yeah, they say about the west of Ireland, there's nothing quite as urgent as manana, so.
Yeah. It's been far too long since I went to Ireland pre-pandemic. I really miss it, actually.
Yeah, Bantry Bay I visited with some my wife's friends who live in Cork, and wow, was that wet and windy.
Yeah.
But the food and the drink and the
part of the
company is
experience.
amazing. Sorry, Jason.
No. It's, I can't just it's all the reason to visit, isn't it? To get soaked.
Yeah.
Well, I worked in the construction industry, and I got to know some amazing Irish folks and have some amazing Irish stories.
I'm sure you have. Right. I think we'll move away from the Ireland focus.
Fine. It's also wet in Reading. Yeah.
Okay, everyone. We give it a couple more minutes. I'll start at 5 past. Give some more people a chance to join.
William, just to say, sorry, the link that was sent out yesterday didn't seem to work for me, so I think some people might find it difficult to. Obviously, we have some people here.
Okay.
But I had to come in through Zoom rather than just with the so that might be holding people back potentially.
Yeah. Well, you can never tell with these things. Dawn, have you had any other kind of feedback about people having problems with the link?
Yeah, I had the same problem. One link worked, and the one from the day before did work.
Dawn, you're on mute.
Okay, I will look at that. I hadn't had any other messages, but I will investigate and try and figure out what happened. Apologies.
The joys of technology, as they often say, it's great when it works. Which, as we know, isn't a consistent story. Okay, let's kick off. Welcome, everyone, and welcome, Jason. I'll say a few words in introduction about Jason in a moment. And that's not beer he's drinking, those of you who can see his pictures, obviously. Let me just do a couple of kind of notices just to make you aware of just what's going on in the events at the moment. We had a shared workshop, a couple of shared values workshop a couple of weeks ago with kind of key NHS leaders from the ICP and from the trusts, and what's now being focused on sounds very sort of grand and very constitutional, but we're focusing on a memo of understanding, trying to kind of nail down in simple language what's the nature of our relationship, how are we going to support each other, what are the kind of things that we want to focus on. So it'll take another few weeks, I think, for that to come out, and we'll obviously share it with people as soon as we can. We've also got 6 of our Alliance colleagues in Oxford today. There's a full-day workshop going on about the development of the NHS Joint Forward Plan. NHS loves those kind of terms, and I won't change it into an acronym, but there's a I think it's really good that as voluntary and community organisations we're being invited into these meetings, which hasn't always been the case in the past. Our working groups are also shifting towards a more kind of aligned way and trying to looking at kind of similar broad themes. And we're keen that that should be co-production and lived experience over the spring and summer. So that's just a few kind of headlines about what's going on. Let me just say something about Jason. He's been leader of Reading Borough Council since May 2019, councillor for Southcote. Have I pronounced that right? Southcote, Southcote?
You dropped the E, you dropped the
All
E,
right.
Southcote.
Since July 2016. So he's previously lectured in history at Royal Holloway and has been a senior researcher for the Theatre Society, which for those of you who don't know is a Labour affiliated think tank. And he's the youngest and apparently the tallest leader in the history of Reading Borough Council. I'm sure we'll have other interesting facts as we go through. Jason will sort of talk to us about his role as the first chair of the new integrated care partnership. Hopefully something about why he believes that the system matters, particularly to the places that we're working in, the counties, the boroughs, and how he sees the role of the VCSE, and particularly about its diversity in becoming a real partner, both at system level and at place level. We're also, very much need to be aware of that we're talking about an integrated care strategy that has to be delivered across a very widespread area, with a population of 2 million or so. And it's important, that we don't forget, and I think maybe we'll hopefully be able to focus a bit on it today, that there are, a significant number of people who don't live in areas that are particularly affluent. And one of the consequences of that is their experience of poor health, 10 and 15 years earlier than their better off neighbours in terms of deaths. So end of the speech, end of the introduction, and over to Jason.
Thank you very much. So I'll try not to talk for too long. I should say, and I was saying to some of the guys at the start, that I've always found talking on Zoom or online a bit more difficult than doing it in person. I think partly that's because I get so bothered by the little image of myself in the corner of the screen, and I know what you're thinking, how could someone so gorgeous be so repelled by his own image? But nonetheless, that's the way things are. So I've often found that a slightly more extemporaneous kind of conversational style works, so hopefully I'll avoid rambling too much. But one other thing I would add to the sort of short bio of me that William started with is to just tell you the kind of moment in my life that really has influenced the way in which I kind of conceive of the purpose of sort of politics and of community. When I was 15, and I grew up in Cambridgeshire, I was outside some public toilets, as one does, and I saw a guy have an epileptic fit, and everybody just kept walking by, apart from me, who ended up calling an ambulance, who eventually arrived. And I remembered thinking at that time, age 15, how sort of disturbing it was that all of these people who were adults, much more capable of dealing with this situation than I, just walked past. And sort of, I often reflect on it, and I don't think it wasn't like a life-changing moment in that sense, but it has made me really committed to the idea of celebrating community and always trying to find the opportunities where I can, as leader of the council or as a ward councillor or in whatever capacity, to try and celebrate community as a way of trying to encourage and foster stronger sense of community. And I do worry that our notions of kind of the bonds between people, those societal things that make community work, have broken down a bit and have been challenged in different sorts of ways by the pandemic, although conversely it was also this wonderful moment of neighbourliness at certain times. So a very confusing world that we live in, but that focus on community always means a lot to me. But that's not what I'm here to talk about. So here to talk about the sort of integrated care system in the Bob area, and particularly the integrated care partnership. I think the first thing I would say is that the integrated care system as an approach can be treated in one of two ways. We could either treat it as just another NHS reorganisation, which will surely in time be reorganised again, or we could treat it as an opportunity, because it's so different to the previous models, to really try to do things differently, accepting that things will change again in the future. But if we can really set the pace and change things now, maybe those principles can be embraced as we move forward. I would much prefer us all to embrace that latter sentiment and to really try to turn the dial on some of these issues that have frustrated all of us for a great many years. It's difficult to do, but let's have a bit of a think perhaps today about how we might do that. So I would say that the Bob area, Buckinghamshire, Oxfordshire, Berkshire West, is inherently in itself a challenge. You know, it's an expansive geography, almost 2 million people. There isn't that much similarity between, let's say, Reading and rural parts of North Oxfordshire. But any system is going to have those kind of disparities. We do have this particular challenge, but just because of the sheer scale of the geography here. But I think we can overcome that, and it emphasises the need for us to keep as much as possible at the sort of place level. So either at the Oxfordshire level, the Buckinghamshire level, or the Berkshire West level, because I think that's how we can make the system work as effectively as it possibly can. Contextually, we also have this tremendous challenge of an NHS crisis. Understandably, our colleagues who work in the NHS directly are very fixated on those very immediate pressures. That's why I think as a broader system, as a broader partnership, we have a duty to try to keep thinking in a more strategic long-term way, never being ignorant of those challenges of immediacy, but to try to set or try to create a space where we can continue to think about the longer term and the opportunities before us. The NHS has always been a sort of responsive, reactive organisation by default, and trying to move towards a much more preventative agenda, something I know that all of you would want to embrace, is probably the most important change we could try to drive forward. We need to overcome a lot of siloed mentality. You know, the silos that characterise councils at times certainly can characterise the health service, can characterise any organisation. We have to understand and think how we might work better together. We also have these particularly irritating challenges of different types of political structure over the area. I mean, in Berkshire West, you've got 3 small unitaries. Buckinghamshire, 1 giant unitary county. Oxfordshire, a traditional, so to speak, 2-tier authority setup. But those are things that can be overcome. It's to do with our mindset, but the structures we work in do make it more or less easy to overcome some of those mindset challenges. So I wouldn't deny that they're legitimate issues. Finance is always going to be a challenge. The Bob area NHS is the least well-funded per capita in the country. You just have to appreciate that. That doesn't mean that things can't be done differently, things can't be done in a more clever way, things can't be ambitious, but that challenge is going to underwrite everything that we try to do moving forward. So what is the integrated care partnership? Well, first and foremost, it is a partnership. And I would conceive of it as being a partnership of every institution and organisation across the Bob area that is interested in the themes of health, social care, community well-being. That doesn't mean that every single organisation is directly represented on the formal partnership itself, just for reasons of practicality, but we have tried to create a sort of constitutional structure that ensures some representation of all of those different interests. Except we might not have got everything right, and we can review it, of course, over time as we move forward. But at the moment, we are hearing voices that otherwise the NHS and perhaps even councils would not have heard quite as clearly or effectively in preceding structures. So I'm really pleased about that. We need to keep developing it, move it forward. I'm very keen that we should have a sort of another kind of, not really a body, but another forum that I've sort of hypothetically called the sort of Integrated Care Partnership Assembly, which is a much more open space where we can all gather together. There's no sort of representational requirement. Every organisation that wants to would be able to attend, and we can use that as a sort of place for those really broad conversations, ensure that everybody's voice is heard, and to ensure that our representative structure is working as effectively as possible. You know, it gives a sort of check and balance in that way. I'm really hoping we'll be able to bring that assembly together at some point later this year, maybe after the summer or just before the summer, if I was being perhaps hopelessly optimistic. But partnership is partnership. We have to get away from a mentality that things are you problems, that things are problems for councils to deal with on their own, or for the NHS to deal with on their own, or for the fire and rescue service or the police. You know, we have to get away from that. We have to think, well, how can we each help one another? What do we need to do differently? What are the challenges in going down that route? How do we have to change our own internal cultures to be more collaborative? It's going to be difficult for all of us. I mean, councils are very proud of their sort of independent sovereignty around these things. You know, it could be pretty difficult just to collaborate around small little nitty cross-border issues around transport, let alone really massive kind of potentially financially difficult decisions around health and social care. And we're all a bit conscious, I think, as councils, and certainly you were, that the NHS is just of such a scale that it could eat us all whole. I would guess, I don't know, that the annual budget of Reading Borough Council is probably what a sort of medium-sized healthcare trust like Royal Berks will go through in about a month. You know, the difference in scale is tremendous. So, having spoken a little bit there more about challenges, problems, I did want to think about the opportunities then. What's the sell of the system? Well, first and foremost is this emphasis that the NHS now has for the first time ever on the wider determinants of health. You know, thinking about the impact of housing, thinking about economic factors and economic inequalities in communities, thinking about those issues of access to healthcare rather than assuming it as a given. We, by which I mean councils and you guys in the sort of broader VCSE community, I think can really be at the forefront of ensuring that the health network, as we might call it, the health network rather than health system, does pay attention to those wider determinants, pays attention to the opportunities in that preventative agenda to ensure that we can move on from just being responsive and reactive when someone is experiencing a crisis or are in ill health, to instead try to avoid things getting to that place wherever possible. There's also phenomenal opportunity on a really basic level to have much more closer joined up health and social care. I have often said, much to the annoyance of some people working in the healthcare sector, that healthcare should really be understood as a sort of limited and specific form of social care. I think social care is the overarching concept, and healthcare is, okay, it's at the sort of sexy end of the spectrum, but that is a form of social care. We need to join them up. We need to have far greater simplicity in moving between what are currently two almost siloed systems. We've come a long way, even in the last decade in that respect, but there's a lot more to do. The other opportunity, I think more clearly for you, is that sort of potential presented to really emphasize what the VCSE can do better than absolutely anyone else. What can your organizations offer that nobody else can do as well as you? And for the first time, I think you've got a really a much bigger platform on which to articulate that and to show the difference that's being made. There's some Other opportunities, I think, around communications. Some of us are better at communication than other groups or other institutions, other organisations. Communications, especially if we're to embrace that preventative agenda and think about why the determinants are going to be key. It's always struck me that the public sector is very bad at having joined up communication. So just on a basic operational level, there are some really clear opportunities there. I would like to hope that we've managed to grab some of those opportunities within the integrated care strategy that the partnership approved at its last meeting. I would be honest, candid about that strategy and say, I think it's really good and it's okay in so many ways, but it could be far more ambitious. But we've restrained that ambition a bit because of the need to walk before we can run. Perhaps especially because of the geographic size of our system. Building partnerships is going to, meaningful partnerships, real partnerships, partnerships that make a difference, is going to take us a bit longer than it might in a smaller geographic area or a more uniform one, like let's say Greater Manchester or something like that. You know, we do have a real challenge in making those partnerships work and fire and produce brilliant outcomes for people. So it seemed right in that context to sort of mitigate a strategy that might otherwise just seem too fanciful and too overwhelming and we were never going to get there. So there is an important role moving forward for the partnership and through the other forums like the assembly I've spoken about to keep an eye on that strategy and say, well, maybe it's now an appropriate time for us to review and revise it, to be more ambitious. We've demonstrated we can do this. We all think we can go further. We need to articulate that so that we have opportunities to try to secure the funding from national government or wherever to push forward and push further and faster. So that's kind of the philosophy that I was keen we used to underpin the strategy as it developed. Prevention, I hope, has been emphasized as the great opportunity in the strategy because it's the biggest culture shift we can make. The NHS, especially as this large organisation, has never embraced prevention in the way that it has response. So just on its own, that's an enormous culture shift. It felt right to me that we, as the other members of the partnership, by which I mean you as well as councils, would want that to be the focus. If we can move the dial, as I've said, on prevention, we can achieve an awful lot. So that's where the strategy kind of fell, as well as providing a basis for us to get away from that you mentality I mentioned. So in summary, I guess, I'm trying to sort of say, well, we're all learning this together. You know, it's new for councils, it's new for the NHS, it's new for the VCS, it's new for the private sector. We're all learning it together. We can perfectly legitimately just say, well, we're not interested in it. We just want to, you know, carry on basically as we were before, try and get some money out of the system, do some specific little projects, make a little change in communities and so on. That's perfectly valid. But I think if we want to, and I certainly want to, and I hope you do too, we can really try to move to something different. We can really try to move to a much more holistic, much more encompassing, much more creative way of working by coming together and really sort of saying, well, you know what, we are partners and we want to be partners. And it doesn't mean that all the time we'll all feel like equal partners, but we are all partners and we all have a role to play and we all bring something special, unique to the table that nobody else can do as well as we can. And for me, place, Buckinghamshire, Oxfordshire, Berkshire West is going to be the key building block in making that work. So I would encourage you all to engage as much as you possibly can with the place directors and the place-based partnerships and the health and well-being boards in your area, but to try to move away from a sort of philosophy that we've had up to now and embrace a slightly different one, difficult though that might be. And even though you will notice surely that some other people haven't embraced it quite as well as you have, but by virtue of the fact that you're all here, I assume that you're keen to move things forward in a different way. Right, that's all from me. Enough of a ramble, I think. And I know that Dawn was particularly keen that we have as much time for questions as possible. So I'll let William fire them at me, I suppose.
Okay, what I'd like people to do, I mean, we've obviously got a lot of people on the call. I think the way we maximize the number of questions that we can deal with is if people put their questions in the chat. And I'll try to make sure I pick up as many as possible, and clearly there might be some that are similar. So while you're doing that, let me just sort of kick off with a question for Jason. One of the pushbacks I know when the strategy was being developed, and as you're saying it's we're taking it slowly, we need to walk before we can run, is that there wasn't enough detail, for example, about conditions, whether that's autism or cancer or whatever. And the pushback was that detail is going to be in the operational plans for each place. Can you just say something a bit more about that? Because clearly the whole kind of thing in terms of split place, as you've stressed, is a critical part of making this work.
Yeah, and I think a strategy, a good strategy, proper strategy, should be about the what and not the how. Or it should be about the why and the what, but not the how. And it's especially important, I think, in this case, because if we were to be sort of over operationalized and sort of in the detail of how something would be delivered, it's no longer a partnership, is it? It's become at some point a kind of imposition of telling other people how these things will be done, because there's nothing really that is the sole preserve of one organization. And care for, let's say, somebody who's had a stroke, the care of that person is not just the responsibility of the NHS, it's also the responsibility of councils who may well be working in partnership with other organizations to deliver that. So it's for all of us to then take the principles of the strategy and think, how do we operationalize that? How do we work this strategy into what we're doing? How do we feed into that joint forward plan that the Integrated Care Board is currently developing? That sounds like a kind of Stalinist 5-year plan construct, but I don't think it's intended to be that way at all. So there's a role for working out how things will be delivered, but it's not through the strategy itself, is my sense. Well, it's not my sense, it's genuinely true. I kind of know how strategies are. But. Okay,
still waiting for questions beginning to come through. Okay, just one more for me at the moment, and then we'll hopefully have a few more questions to pick from. A lot of what we're talking about is based on trust. And you talked about silos, both in local authorities and in the NHS. How do we build up the trust that's required to make this work?
Yeah, that's a really difficult one, isn't it? I mean, because there's both that sort of human level of trust. You have individuals in a council and individuals in a charitable organisation, individuals in the NHS, and there has to be some trust between those people. But actually, if we only build the trust between the individuals, well, when individuals change, as they do, my Labour group could decide to get rid of me tomorrow, right? Then the trust might break down. So it has to be predicated more so on, I think, as having shared visions and shared goals and co-production of how we're going to do things, why we're going to do things, and what the things we want to do are. I wouldn't say that it's going to be easy. I think it's going to be really difficult, actually. And I think at times we'll probably be very successful in building mutual trust between people, and then something will go wrong and things will break down a bit. And we have to sort of try to get back on the wagon in circumstances like that. I think we've all had moments like that in the way that we've engaged with one another anyway. We just need to be conscious that things are not always going to be perfect and that things will be difficult. Okay. But if we're all trying to fundamentally achieve good and we have some agreement on what that good looks like, we can do an awful lot working together. So maybe it's the outcomes, the delivery, actually seeing difference on the ground that will help us over time to build a much more enduring, institutionalized sense of trust.
Okay, we've got a couple of sort of linked questions about resources, and we know that certainly we're talking about the voluntary community sector, how kind of stretched resources can be, whether that's to do with direct delivery or in supporting, what second tier organizations are supporting a number of others. So we've got questions about how do we think, the sector, are we generally going to have opportunities to be involved in developing joint services, to get funding to be involved in doing that? Because that's, clearly we're talking about different power dynamics across different organizations. There's also linked to that a comment about, let me just find it, Leeds and Bradford ICS top slicing 1% off their budget and using that to fund the volunteer and community sector. So I think there's the whole kind of issue about how do we sustain the sector? How do we pay for both the kind of all the kind of engagement that we need to have in planning and discussion, and how do we ensure that we can be genuine partners in co-production and be funded for that?
Yeah.
Big question.
So no. I mean, it's the key question, isn't it? And the first thing I have to say, and it's not to evade the question because I do have proposals, is that the partnership itself and the partnership has no budget, right? So everything that the partnership works on is kind of in-kind donation of Oxfordshire Council letting us use their meeting rooms and so on and so forth. So those budgets sit with the Integrated Care Board, and I think you've had Jarvid along to speak to you separately a few months ago. And indeed, of course, councils have their own budgets and other organisations do. So the partnership itself can't make those kind of decisions. What is needed, I think, quite clearly, is some proper transparency, governance, sense of how opportunities are going to be structured for VCS organisations to access funding. And I don't think the board has yet got to that place. I know that they've been having discussions, and there's certain pots of money they get from government, and they'd like to work out how best to use them in each of the different places and so on. But we have to have some transparency around it. I mean, I would want to see, but I would say this, wouldn't I, because I'm from Reading, a maximal amount of funding going to those areas with the highest amount of inequality, because that's where it can make the most difference. It's a simple utilitarian argument. But I'm sure that some of my colleagues in other places might not want to see that, would prefer a different kind of funding model. So there will doubtless be arguments around that. I think one of the things, when I've reflected on this, I wonder if I can do with Reading, and hopefully other council leaders come along with me, is that when we are looking to fund, commission particular services that are within the sphere of the integrated care strategy, whether we really seek to say to the NHS, will you come and match fund us on this? We can do a lot more by working together. We can do the governance, the transparency and so on, but you need to match fund us, and to try to use that as a way of calling their bluff, calling the bluff of whoever controls the purse strings to back this kind of work that's going on in places and in communities. So I don't have any easy answers to that at this stage, but it is the thing that with the strategy now done, I'm keen to move an increasing amount of my time and attention to, because there's no point coming up with great and glorious plans if we all lack the capacity to deliver things. And capacity is a problem for councils, problem for you, problem for the NHS. We need to have a discussion around this, however difficult it might be at times.
Okay. We've had another question about equity and the imbalance of power, but I think you've tried to address that a bit. But I think it's one of those things that doesn't go away. We need to kind of recognise how significant it is. And if we're serious about partnerships, clearly we have to have not just equal esteem, but it needs to be a recognition that the voluntary sector doesn't have the same amount of resources in terms of people to attend lots of meetings and etc. So we have to sort of manage the kind of expectations around that while wanting to engage as far as we can. There's a couple of themes coming through in terms of place. how do we ensure that actually we know how important place is in this structure, but how do we ensure that place can actually make their voice heard, and have there's some kind of equitable recognition of different needs, while also recognizing that you know, there are clearly those kind of pockets of deprivation where needs are higher in some places. So could you just address that?
Yeah. So tracking back to the imbalance of power point, I mean, you know, it's also because the way that we construct power is based on legitimacy, isn't it? And because all of the different organizations that form the partnership have a different basis of legitimacy, so we can end up sort of talking slightly different languages. And that's okay, I think, so long as we recognize that others are bringing something equally legitimate, but in a different way to the table, a challenge for us all. How do we ensure that the voice is heard, particularly of those areas that need the most support? So I think, you know, that every place is developing its place-based partnership. Every place will already have at least one, and in some cases, or in one case, 3 health and well-being boards. And I think it's about how do we use those structures to try and get points across? How do we best sort of how do we best take councils as well? How do we use councils best in this system? You know, so I think in Reading, there'll be lots of things that the Reading VCS organisations will know about that I don't know about, or they've known about it sooner than I do. You know, and we will communicate, we'll talk about things, but then how does the council ensure that it doesn't just say, oh, you know, that's a problem, we'll tell the NHS about it, but instead amplifies those voices coming from communities? And I need to think about that and what that looks like. And I think as the structures develop, some of those opportunities will come a bit clearer. But in the meantime, I think it's fairly obvious that because government works in a sort of, at least nominally anyway, let me reframe that, because the civil service works in a sort of rational based way, I think we have to be able to make rational arguments about why some places need money and what the return on investment would be. It can feel uncomfortable to talk about return on investment when it's things about health inequalities, but if that's the language that the funders talk, that's the language that they talk, and we might need to play that game at least for a time.
Okay, kind of just sticking with the whole kind of thing about place, clearly the other kind of component which have been highlighted is, I mean, place itself can be broken down into neighbourhoods and localities, and clearly a number of kind of voluntary and community organisations are working, you know, at a very local level. And you know, we were talking about power. There's a huge difference between the influence that a larger voluntary organisation can have and perhaps a small local one. And there's also the challenge between a focus on service provision and a focus on advocacy and training. So have you any thoughts about how we make sure that those kind of smaller local voices and the neighbourhoods within the places actually are able to have their voices heard?
Yes. So one of the most important things, I think, I mean, I love small community organisations, and you know, I think that what they offer is tremendously important and is perhaps not celebrated enough, and a pivotal relationship that can really give voice to those is between ward councillors and those organisations in their communities. And I have always encouraged all of my councillors to engage with those groups, whether or not they're friends of the Labour Party or friends of those councillors. You know, they have to engage with them, they have to listen to them, they have to give voice. It's perfectly fine for there to be disagreements between smaller groups and ward councillors, or between one smaller group and another smaller group, but we have to be able to give voice to them and allow that sort of discourse and debate to happen. There has to be clearly an emphasis placed on infrastructure, VCS infrastructure organisations in each area. I do hate the term place, by the way, William. I mean, you're right. I mean, we can use it so generically, but it's what we've got, and it's a bit frustrating. Maybe we can seek to amend its usage, at least in our area. You know, so we need to ensure that the sort of infrastructure organisations are looking after the sort of interests not only of the sort of larger service provider organisations, but also its community groups. As councils, we need to think: do we have the right forums in place? Do we have the right sort of opportunities for people to feed in through consultations and so on? Do we give due recognition to those groups in some cases? Yes, and I think it's one of those things that a decade of austerity has made us all a little bit less conscious of, because we've all been a bit more insular and so on. So the smaller groups, how do we continue to foster them, is important. I would return to the point I've kind of alluded to in other places as well with the trust argument. The smaller an organisation is, the more it tends to be dependent on particular individuals rather than sort of particular structures. And sort of an individual leaving an area or sort of retiring or passing away can have a completely catastrophic impact on the work that a small organisation was doing in a way that the larger one might be a bit more adaptable around. So there is always a kind of consciousness around that as well. It was a very rambly answer, but I think I covered some ground there.
Okay, there's a comment about the relevance of public health and their population health management teams, and how they can have a great insight into making a case for places. And I think that's an important point, and clearly that's something that local authorities, for example, have been involved in with the year for quite some time. Any thoughts on that?
Yeah, and I think public health teams, because of the pandemic as well, have become much better at looking outwards and trying to work out how so we had a very, very successful programme here in Reading, the sort of community vaccine champions, and we're now trying to take the learning from that, and how do we use the learning about getting people from hard to reach groups vaccinated to apply it to other public health issues, other general health issues that exist in a very diverse town like Reading. I would hope that as we sort of move that forward, we'd be able to share some of the learning from that with you guys and with our other partners elsewhere in the system. We need to think about how we best share data. It's one of those things that's really easy to say, oh, share data, but actually data can be overwhelming and it can be presented in this. So understanding what the data sets are and to sort of really hone in on things which are good proxies for some broader issue is going to be a key challenge for us all. But if we get it right, it could be a really brilliant opportunity for us as well. I'm really pleased, I have to say, that public health responsibilities, duties have sat with councils rather than being returned to the NHS. I think I'd like to think that whatever else we get wrong, we've probably got public health duties a bit better than they would be if they were in the NHS.
We've got a particular question here about the strategy, which I think is important. You know, clearly the strategy looks at a number of different life stages: start well, live well, etc. And you know, there's a clear point about here. Why was start well not as significant a part of the strategy and seen as essential to all plans? And I think that's a very legitimate point. I mean, obviously, it means we're looking at the detail of what the strategy says, but certainly looking back on it, it seemed to me that that's a legitimate criticism, that perhaps not enough focus on, if we're talking about prevention, focus on start well.
Yeah, I think that's fair. I do think that's fair. I don't think there was any intention to sort of suggest that it was less important. But I think, you know, depending on your particular mode of textual analysis, you could quite easily come to the conclusion that it is. And so in practice, you know, how does intention match up to the reality? So I think it's a very fair challenge. I mean, the answer is going to partly lie in the fact that because of the way that partners kind of come together, because of the particular preoccupations of adult social care services and health care services, it is going to sort of pull towards the older end of the spectrum. Remember that sort of context of particular and acute NHS crisis. So certainly something we should be looking at and seeking to review as we move forward. I also think that at the sort of younger end of the spectrum, we start to bring in far more potential partners who are not yet part of the sort of integrated care partnership, or not yet conceived as part of this broader community. And so there is a bigger piece of work to be done beyond our area and thinking nationally about how we get that much more holistic group of organizations together for people at the younger age spectrum. It's a good challenge. It's a very legitimate challenge.
Okay. There's a comment here, I think, which links back to the kind of the more traditional role of councils in terms of support for voluntary and community organizations, and asking, well, and councils do a bit more about amplifying the VCSE voice. So I think that's the first part of it. The second part is, I think we need to look at the context that clearly with all the cuts in funding that's come right across the system, but more than 40% odd, in terms of local authorities, clearly there's a gap where voluntary community organizations used to get funding for some of this work, which isn't yet being picked up by the NHS. So amplifying voice, your role, shifting of filling the gap that was left by the cuts made to local authorities.
Yeah, again, entirely valid challenges, I think. So I would happily concede, because it's something I'm trying to work on now, that in Reading, for example, we've got a real gap in our we've got the commissioned VCS services, we've got a small grants fund to look after those small, or help give opportunities to those smaller organizations. There's a gap in the middle there of some sort of core grant support and so on that we don't have in Reading, and it's something I would like to rectify if I can find headroom in our budget moving forward to do so. So I think it's important that we always accept that whatever balance we choose to have, there's going to be some deficiency, and how do we mitigate that? And of course, things are always going to change, because it's so easy for national government to affect our settlement that it's hard to have permanence around these things. Amplifying voice, yes. There's a quid pro quo with that, which is the more we amplify voice, the more the sector would also have to be prepared that we might criticize that voice and that we might disagree with it. And I think it's often been easier, hasn't it, for us all to sort of agree that we don't want that, so it's a part of a maturity of partnership. I think that we would be able to sort of publicly criticize one another without worrying that it's going to cause some massive political rupture, or that it's going to sort of tear the trust between us apart and so on. So we have to have mature discussions around that, and think about what that might look like, because I don't think it's as easy as it sounds when you say it out loud. I think it's actually difficult.
There's another question here about a gap, and again, you've touched on that, but I think it's worth making this point. Talks about the NHS women's health strategy, highlights the kind of significant issues for women's health, which our strategy doesn't seem to recognise. Why not, do you think?
Well, I think because it seeks not to replicate what's in other strategies, and because that exists. But again, I think a fair challenge that would say, well, if someone's referring to one document, they at least need to know where they're going to look for the other stuff. So probably in terms of the presentation of the strategy, a change we could make is some more cross-referencing to what's elsewhere. So I became a bit more conscious of this in Reading. Recently, we published a tackling inequality strategy, and we decided it made sense for us to talk about, well, what the strategy isn't and why it's not, because these things are covered elsewhere, and actually the integrated care strategy doesn't do that. So it's probably incumbent on us to help signpost to the right place, so we can all understand how these things connect together in a bit more of an elaborate nexus.
Okay. we've got through quite a few questions, so I think let's sort of try and wind up, and we've got a number of sort of themes coming through. Stephen, would you like to just to kind of help us wind up, pick out what you think are some of the key things coming through, both from what Jason said and the questions and the responses?
Yeah, thank you, William. I'm keeping an eye on the chat box and listening to the questions. So, I mean, everyone will have pulled out their own kind of key issues and potential actions. The ones that I've sort of noted down as really interesting are where Jason started with the commitment to community and fostering stronger communities. And I sort of scribbled down this idea that charities, the voluntary sector, that's the part of society that doesn't walk past problems that we might see around us. So I think we've got that in common with Jason. I think there's a really interesting issue around the access to funding, particularly for prevention. And I noted as well the point about the early years, and I scribbled down your point, Jason, about the transparency of access. And I will just reference, there's been a national report, which is very technical, about how public procurement is marked as being appropriate or not for the voluntary sector, that was commissioned by central government. And I think that's something that we might try and give a bit of attention to in the Alliance in Bob at some point in the future this year. Also really interesting idea about councils trying to persuade the NHS to match fund preventative working towards the prevention end, and bringing in the voluntary sector to that. I think that's something we should pick up and not forget. Jason's advice to us all, I think, is worth repeating, about focusing on the engagement in the health and wellbeing boards and the place partnerships. And of course, those are all, some of those, especially the health and wellbeing boards, are structures that have already existed and are working more or less well in different places. The one sort of note of caution I have about that is that the access of the voluntary sector infrastructure organizations to those emerging place-based partnerships has been very uneven. It is going very well in Oxfordshire, for example, but not necessarily so well in Buckinghamshire. So I think that's something that needs looking at as we go through the year. I find it a fascinating idea, and maybe this already happens and I don't know about it so much, but you know, we're talking about, Jason's talking about how ward councillors can amplify the voices of smaller VCSE organisations. And I think that's a really interesting one, because what struck me then is that, you know, we call ourselves the voluntary sector, and a lot of it's based on volunteering, but of course a lot of local politics and campaigning is volunteer based at a certain stage of its development. So there may be something to think about there, and of course I guess that's quite different in a way to how the NHS works. And when we did a survey last summer about the attitudes of our members in the Alliance to the NHS and to the councils, we actually found that there was a stronger kind of relationship between councils and the voluntary sector than there was between the NHS and the voluntary sector. So I think if we can get the councils and the voluntary and the NHS working closer together through the opportunities that Jason identifies, then hopefully the councils can help pull the voluntary sector into those big strategic conversations and actions.
Okay, thanks, Stephen. There's one very important question here. I mean, I've tried to sort of, pick out sort of as many as I can. There's one here which is probably unanswered, but that we can't answer, but I think it's important to flag it up. Says it's a simple question. So given the stated commitment to partnership across the public sector, commissioning, contracting, how is social value being captured, measured and implemented to ensure local organisations can actually access bids, tenders and partnership delivery? That's a very big question, and I think we've tried to touch on it a little. I think that there's a challenge to the Alliance as well, in terms of how are we going to contribute to measuring and sharing social value. It's a critical. You just want to comment briefly on this whole kind of social value point?
Yeah, well, I mean, you need to define it, and you can define it in different ways. I mean, we have a document in Reading that does define, what we look for, how we define social value. I think we accept that we need to continue to amend that and to keep working on it. We're all waiting for changes to procurement regulations and to procurement law to give us a bit more flexibility. But it has to be in some way codified. I think it's tempting to talk about social value in a really diffuse sense, but it doesn't work. You know, we have to have some sense of what we're looking for, and that will be different in different places. It might be different in North Reading to South Reading, let alone across so I think the question is, in a sense, simple, and the answer is we have to define it so that we're all working from the same premise. You know?
Yeah, I mean, definitions are always difficult. I mean, I've done a fair amount of work in the past in terms of social value and focusing very much on, you know, needing to recognize that organizations have to be able to understand, but what social value do they create?
Yeah. But I mean, it's a simple, so let me give two examples that don't, yes, the sort of challenge. So one would be fast broadband, right? In social value terms, that has nothing in Reading because we already have it. But actually, in sort of some rural communities in Buckinghamshire, Oxfordshire, the social value of being able to deliver that kind of stuff might be greater. Another one would be buses, right? So in Reading, we own our bus company. And we often have this debate then, well, what's the social value it delivers as opposed to the financial value it delivers? But any bus delivers social value, whether it's privatized or municipalized, you know, so it can be quite a complex conversation, but we have to accept that a universal definition is probably not reflective of the complexity of communities and societies, and we have to have localizable ones at the council level, or maybe even smaller than that sometimes.
Okay, I mean, it's a big area, and in fact, it's one of those things that will be interesting to have more time to kind of dig into. But thanks very much for your responses. Okay, so just in winding up, can I say thanks on all your behalf to Jason for sharing his thoughts with us, for thinking on his feet and kind of responding to all the questions. Let me just say something in terms of where we're going to next. Our next meeting is on the 29th of June. We have just commissioned a quantitative study to try and look at the whole kind of thing about the scale, the size, and indeed the impact of the VCSE across Bob. And that's drawing on kind of methodology that's been used in Cornwall, Yorkshire, Cumbria. So we hope to have as our guest speaker at that meeting, Professor Tony Chapman from Durham University, who's going to be heavily involved in undertaking the resource. And just in case you're thinking, we're kind of, you know, we're spending very, very limited resource on this. We're not spending any of our money on it. We've actually got money from NHS England to actually do this. But I think it's really important that we try to kind of find out as much of this information as possible. So thanks again to everyone. Thanks to Jason. Just coming up to 1 o'clock. Enjoy your lunch if you have time to have it. Take care. Thanks, everyone.
Thanks, Jason. Just to say, there's some lovely supportive comments in the chat, including good effort to getting partners to come up with a strategy that reads well and sets out the ambitions. So there's lots of support in the chat for you and the work that you've been supporting to happen. Thank you so much.
Thanks, Em. Thanks, everyone.
Oh, that's nice. I'm glad my friends turned up. Thank you all.
Bye, everyone.
Right.